What is the neurobiology of addiction? Have you ever wondered why some people seem more vulnerable to addiction than others? The answer lies in the complex neurobiology of addiction, a chronic brain disorder that affects motivation, reward, stress response, and self-control. Addiction typically progresses through 3 stages: intoxication or binge, withdrawal with negative emotional states, and preoccupation or anticipation of drug use. At the heart of addiction is the brain's reward system. This system primarily involves dopamine, a neurotransmitter that signals pleasure and reinforcement. When someone uses addictive substances, dopamine levels increase in specific brain areas, such as the ventral tegmental area and the nucleus accumbens. This spike in dopamine reinforces drug-taking behavior, making it more likely that the person will seek out the substance again. However, repeated drug use leads to neuroadaptations, which are changes in brain circuits. These changes reduce the brain's response to natural rewards, like food or social interactions, while increasing sensitivity to drug-related cues. As a result, individuals may find themselves compulsively seeking drugs, even when faced with negative consequences. During withdrawal, the brain's stress and anti-reward systems become more active. The extended amygdala, which includes the central amygdala and the bed nucleus of the stria terminalis, becomes hyperactive. This system releases stress-related neurochemicals, such as corticotropin-releasing factor, norepinephrine, dynorphin, and orexin. These chemicals contribute to feelings of irritability, anxiety, and discomfort during withdrawal. This negative emotional state can drive individuals back to drug use, perpetuating the cycle of addiction. The hypothalamic pituitary adrenal axis, which regulates the body's stress hormone releases, is also affected during addiction. This can increase vulnerability to relapse. While the brain has some buffering mechanisms, like cannabinoid and neuropeptide systems, these may be impaired in individuals with addiction, making it harder for them to cope with stress. Changes also occur in brain circuits related to self-regulation and decision-making, especially in the prefrontal cortex. This dysregulation weakens inhibitory control and cognitive flexibility, making it challenging for individuals to resist cravings or adapt their behavior. Glutamatergic projections from the frontal cortex to the nucleus accumbens are crucial in triggering relapse, especially when faced with stress, drug cues, or drug re-exposure. Genetic factors play a role in addiction vulnerability as well. Variations in genes related to dopamine, opioid peptides, and neuropeptide Y can influence an individual's susceptibility to addiction. Understanding the neurobiology of addiction reveals that it is not merely a failure of willpower. It is a brain disorder involving altered reward and stress circuits. Treatment approaches aim to restore balance in these systems, reduce stress sensitivity, and strengthen cognitive control to help prevent relapse. Addiction results from neurobiological changes that enhance the brain's stress and anti-reward systems while impairing reward processing and self-regulation. These changes drive compulsive drug use and increase the likelihood of relapse, making addiction a complex disorder that requires effective treatment strategies.